Hi, everybody. This PowerPoint will be focusing on the urinary system and reproductive system anatomy, starting with reproductive system in males. So if you take a look at this, and I'll come back to that because this is more urinary system than reproductive system. So what we're seeing here, this is a male reproductive system. So let's go ahead and get started. This is the lateral view of the male reproductive system, starting with a couple of the structures that are also associated with urinary system. We have the tube that is coming from the kidneys, bringing the urine down. That's the ureter. And ureter empties that urine to this muscular sac you see right here, which is the urinary bladder. Again, kind of orienting yourself, the tube that coming out of the bladder is the urethra, and this urethra is basically both used for the reproductive system in terms of ejaculation of semen and in terms of urinary system for the excretion of urine. So what you also have in the posterior aspect of the bladder, you have the rectum, which is the end of the digestive system. Right underneath the prostate, right underneath the urinary bladder, you have this organ. This is about the size of a chestnut, which is referred to as the prostate gland. And you can clearly see the urethra is passing through this. The part that is also added is this extra tube right here, which is actually comes from the gland that sits right over here. And I'm just kind of depicting for you guys, even though it's not shown here. This gland that is right behind the urinary bladder is called seminal vesicle, and I'll show you guys in the next picture what it, where it is located. Again, in this picture they don't show that. And going further down, right below the prostate, again wrapped right around the urethra, you have this little gland. It's about pea size, and that's bulbourethral gland, which is one of the accessory glands of the reproductive system for males. Going down, again, you have the urethra, so the tube that is extending from the bladder and excrete either urine or ejaculate semen is this tube right here. If it's passing through the prostate gland right here, this region specifically is called the prostatic urethra. As it passed through this membrane, which is actually called the urogenital diaphragm, right here, that line. So this small region right here is called membranous urethra. And as it continues through the length of the penis, you refer to that as penile or a spongy urethra. Located external to the body, you have the testes. In this picture, they're not depicting the epididymis that sits right on top of it. And the skin surrounding the testes called a scrotum. Now here is a different view of the male reproductive organs, kind of more detail. Basically, this picture you can see here will fit right on top of on this model. So it's the other half of this model, basically. So again, what you have is the testes. So testes are responsible for production of the sperm. You have these coiled tubes you see right on top of the testes that forms a comma-shaped structure called epididymis. This is where the sperm matures. And when it's ready for ejaculation, it passes through this relatively long tube that goes up, circles around the bladder, and joins the seminal vesicle gland that is behind the bladder. This long tube is called vas deferens. However, if it's bundled with its blood vessel, which are the arteries and veins you see right here, that is referred to as the spermatic cord. So if I specifically ask for the name of the tube, your answer would be vas deferens or ductus deferens. So another name for it is ductus. And if I ask you what is the structure with the blood vessels, again, that would be called the spermatic cord. Now, this structure you see right here, that's the bladder. Oops, sorry, I can't spell. the bladder. Right underneath the bladder, this is the prostate gland. And again, right behind the bladder, you have these paired organs, which is the seminal vesicle. I just noticed it kind of looks like a bunny. Now, this tube that is coming out right here, emptying into the bladder, that's the ureter that we discussed earlier. That's the tube that basically brings urine from the kidneys. The external genitalia, you have basically the penis, the enlarged tip of the penis, which is called the glans penis. For the female reproductive system, looking at the main organs, what we have is the ovaries. This is an almond-shaped organ located within the pelvic cavity. You have these little tiny finger-like extensions that pick up the egg when the ovary drops it. These are called fimbriae. And fimbriae drop the egg into this tube you see right here, which connects to the uterus, called the uterine tube or fallopian tube. Fallopian tube. Now, fallopian tube connects to this muscular structure right here called the uterus. Underneath the uterus, you have the urinary bladder right here. And again, notice that the tube that exits the female urinary bladder is urethra, and it's not shared with the reproductive system. Reproductive system has its own opening right here, which is vagina. It's not labeled right now, but you will see it in the next labeling. And again, this is one of the most important differences between male and female reproductive system, where male shares the urinary system and reproductive system for ejection or ejaculation and excretion of urine. In female, there are two separate openings that one uses for intercourse and childbirth, which is vagina connected to the uterus. And the second opening is for urinary system, which is urethra connected to the bladder. Now, female have also erectile tissue like the male penis called the clitoris. There is a fatty layer right in front of the pubic bone protecting the reproductive system called mons pubis, which is more pronounced in women than it's in male. And again, looking at this picture, and you can see the labeling in the next slide, right behind the reproductive system, you have the continuation of the digestive system. So this part is the rectum. So if I'm labeling this and I'm just kind of orienting yourself again, here is your uterus. The narrowing at the end of the uterus, that's cervix, basically the neck of the uterus. And this tube is vagina, which is basically, again, used for intercourse and childbirth. So cervix, rectum, vagina. External genitalia in female, we have two sets of lips. The outer one that is very similar to the scrotum in male. It's basically skin, and this is referred to as labia major or majora. And the inner folds of the or inner lips, which are more vascular, called labia minor or labia minora. Looking at some of the other structures, so this is a different view of the same model. Again, orient yourself. We have this really muscular tube, which is uterus. The opening of the uterus is the cervix, and the continuation of it opening to the outside is the vagina. Underneath the uterus, you have the bladder, which excretes urine through the urethra. And again, this kind of makes sense because if a woman is pregnant, as the baby gets bigger, as the fetus gets larger and larger, it basically pushes down on the bladder, making the bladder or limiting how much urine the bladder can carry. So a pregnant woman uses restroom quite too often because basically the bladder cannot expand under that conditions. Again, you have your almond-shaped organ ovary. You have the fimbriae and the tube coming off of that, which is the uterine tube. And the tube that is coming and basically emptying urine to the bladder right here, that's the ureter.